for your presentation. Mary Ruth has a copy of those who wish to address this issue. You're recognized.
Thank you, Mr. Chairman and committee members. It is a delight to be back with you on this bill.
It's nice to have you.
I like this committee a lot. This is very similar to the one that we passed out of here and out of the House last year with some additions that were agreed upon. Basically what the bill does is it regulates abortion clinics to the extent that ambulatory care centers are regulated. Currently there are no provisions under the law that would provide for standards of care for abortion and reproductive centers. And so this bill sets out the standards and defines the terms and the legislative intent and findings from the legislature on how these clinics should be, what am I trying to say, should be regulated or watched or taken care of, like we would want ourselves and the women we know to be taken care of in other public medical centers. It defines, Section 3 in here defines the words that's used in the Act, and Section 4 deals with the physicians who may perform the abortion. Only a physician may perform it, and it needs to be a physician who has privileges at a local hospital and who's licensed by the state. And the physician also needs to remain on the campus until the patients are discharged and provide the Department of Health the name, the patient, and the telephone number, his telephone number, to the patient so that he can be contacted in case there is an emergency or there are further complications, as was the case in the clinics in Birmingham last year. Section 5 deals with the procedures that must be under the supervision of a registered nurse professional. We need to have RNs there, once again, just like we do in other medical clinics. Patient care in Section 6, patient care in the abortion clinics must be given pursuant to the current standards of care as we have for other medical clinics. And only Section 7 deals with the prescription of the physician that gives a prescription for abortion-inducing drug, and it must come from a physician. It can't be just from anybody that might be working in the clinic. The state board, Alabama State Board of Medical Examiners, set the guidelines, and the physicians performing the abortions must meet those guidelines. Another section of it is that if a child under 16 is seeking an abortion, the physician needs to ask her who the father of the unborn child is. And of course, if it's a minor, they can refuse to, as a minor, they can refuse to provide that information, but we ask that the physician be encouraged to get that. And then if the father is 2 or more years older than the woman seeking the abortion or the child, the information needs to be reported to local law enforcement and to the county DHR. Of course, it's already in statute that if it's 14, if the girl is 14 years or less, that has to be reported anyway. So we're just moving that to asking for permission for it to be 16 as well. And then Section 11 deals with the Board of Health adopting the rules of this act as it's adopted by us. And then Section 12 sets out the guidelines for it being Class C felony if a physician performing the abortion or dispensing the morning and after pill or other abortion-inducing drugs. If it's not a physician, it is a Class C felony, and it sets guidelines for the administrator of the abortion clinic as well. And then Section 13 deals with the civil damages against a person who might attack or cause personal injury to an abortion clinic. Section 14, the physician or nurse or other licensed professional may have their license taken away if they violate this act. And then Section 15 just deals with the Department of Public Health obtaining injunctive relief for an abortion clinic that violates the act. They already do that, but we just wanted to make sure that was in there. And then the severability clauses, and it does state that the Alabama legislature may appoint one or more persons to intervene in a lawsuit that might challenge this act. It gives effective dates of the act, and that's as brief as I can give synopsis of this bill. But
does anyone on the committee have any questions of Representative McClurkin, or if you would prefer to have your questions after the public hearing, that's your choice as committee members?
One quick question.
Representative Lee.
Today, what is the law as far as minors having abortion? Do you know that?
Minors being a 14-year-old, they must have, they must bring a parent with them to the abortion center, and they must have identification of who they say they are, and have consent, parental consent.
So they're not required by law if they're 15 to bring the parents with them?
17.
Yes.
17.
Well, see, when I looked at this, 18 is the age of consent.
18 is the age that's required.
But then the legislature, have classified a minor as 14 or below. So that from 14 to 18 is kind of
In the gray area. And this would clarify that?
not really.
No.
It just gives, it gives those from 14 to 16 the ability to say, who the father might be.
I know, the statute.
Yeah.
Representative Hubbard.
Representative McClurkin, I'm looking at, I believe this is section 4, page 7, sub C. It seems to say here that every physician referenced in this section shall have staff privileges at an acute care hospital within the same standard metropolitan statistical area as the facility is located. Could you explain to me the difference between staff privileges and referral privileges? I'm not in the medical profession. I'm trying to understand how that language might impact the overall effect of this bill.
If I could ask Representative Weaver to respond.
Representative Weaver, you're recognized.
The experience that I have with that, the reasoning for that is if you have staff privileges at a hospital, you're then able to go there to take care of your patient if they have a medical complication. Whereas if you don't have staff privileges, you have people who are doing all these procedures, they're just sending them, say, go to the nearest ER if you have a complication. So it puts the physician responsibility with the physician of if you take care of a patient. And this is nothing that's really out of the realm. Every ambulatory surgery center, everybody who performs surgical procedures now, the physicians on their staff are required to have immediate privileges at the hospital so they can take care of their patients if there's a complication, and that's just the patient safety issue.
And staff privileges.
Yes.
They're required to be
The
able
refer,
to see.
Oh, wait just a minute now. Wait a minute. Representative Weaver has the floor. Have you made your statement? And Representative Hubbard.
Follow up. And I've heard that one of the concerns with this particular piece of legislation is that in other places, other states that require staff privileges, that has shut down many of these clinics. And I want to be clear, I'm all for holding these clinics to the standards that we hold ambulatory care centers to. But, you know, are there circumstances under which a physician could have a contract with a physician who has staff privileges? Under this bill, would it provide for that?
If a part of a call group,
Yes.
yes, or the